Hello and welcome to the Richmond Speech and Language Therapy Parent Information Talk. This is a presentation for parents and carers with children who have language and communication difficulties and is aimed at those children starting school in September. Over the course of this presentation, we will cover how the Richmond Speech and Language Therapy Service works to support your child before they start school and once they're in school. We will look at the development of communication skills and identify strategies to support the development of language and communication in our language pyramid. We will then share the idea of special time and how to implement communication strategies into your child's daily routine. This flowchart explains how our service works following a new referral of a preschool child. Parents and carers of children who have been referred attend a parent talk like this. Then further information is gathered by a speech and language therapist from the parents or carers either face-to-face or over the phone. If your child has mild or general needs, then it is expected that these needs will resolve with environmental strategies that are provided for you at the parent talk, and your child will be recommended for discharge from our service at that point. Your child will then be on our self-referral pathway. Children on the self-referral pathway can be re-referred to our service by phoning in, and the phone number is on our website, which will be covered in the next slide. Re-referred children are fast-tracked to further assessment. If at parent talk we decide that actually we need further information about your child, then you will be invited to bring your child to an initial intervention package, which includes bringing your child into a clinic setting so that we can meet your child, do some assessment and some therapeutic work with them, and also gather more information from the parents and carers, and so that we can work together over a period of several weeks to pull together a very detailed report and package of care for you and your child to follow. Once your child is ready to start school, the early years speech and language therapist will provide a transition report outlining the strengths and needs of your child's communication, as well as recommended strategies and programs of intervention that can be followed by school staff within the school. The Richmond Speech and Language Therapy Service in school does work in a different way to the early years service, in that it is a consultative service within the school. Every local authority primary school in Richmond has an allocated speech and language therapist. The speech and language therapist for the school meets on a regular basis with the Special Needs Coordinator or SENCO. Our consultation service within school includes meetings with the SENCO and staff, training to school staff, sharing resources, and providing programs of intervention that support language and communication. We have a telephone advice line. The details of the telephone number and email contact form are on our website at the address below. On this telephone advice line, you can request advice or information from a speech and language therapist by leaving a message. The advice line is open to parents and schools. If your child has an Education Healthcare Plan or EHCP, or if your child is undergoing statutory assessment towards an EHCP, then consultative visits will be identified on that plan from the allocated speech and language therapist to the school, and your child will be seen directly in school. We are a consultative service, and we work in partnership with you to support your child developing language and communication skills. As you can see from the diagram, the child is in the centre with their parents and carers. As parents and carers, you have the greatest influence on your child. You know them best, and you spend a lot of time with them. Your child and yourselves are then within an environment that makes sense to your child, is the place where your child is day to day. Speech and language therapist sits outside of this circle, and the reason for this is that we are facilitators, and we facilitate through developing strategies that you can use with your child to support their communication. If your child is offered sessions, these will be used to model activities and strategies to you, so that they can be put in place in a natural environment that makes sense for you and your child. Think of us as your personal trainer at the gym. We can recommend and show you what to do, but unless you put in the work outside of the sessions, you won't notice positive changes. We are now going to introduce the different skills needed for successful communication, as presented in our communication or language pyramid. In order for children to engage in communicating with others, they firstly need to have a reason, an opportunity, and the motivation to interact, and to feel secure in their attachment with others. Once this is in place, attention and listening skills are really important. They underpin everything, as children need to be able to attend to language around in order to learn. Communication is a two-way process, and interaction skills are the next level of development. They include non-verbal communication such as eye contact, using gesture, facial expressions, and taking turns. Play skills also develop social skills, and play is the window on how your child is understanding the world around them and also language. Understanding language is the bridge to talking, as children need to be able to understand what words mean before they can say them. Talking typically follows understanding and includes the words your child is able to say and how these words are then used in sentences. Finally, at the top of our pyramid we have pronunciation, and that is the way your child says words, how they are articulated and the speech sounds that are used. We often see pronunciation as the cherry on the top, as all the other skills need to be in place for successful communication. If we think about the skills on the communication or language pyramid in terms of attention, play, interaction, ability to understand and to speak, by the time your child starts school, they need to be able to pay attention to adult-led activities such as carpet time, to share, play and take turns with other children in their class, their peers, follow instructions such as wash your hands, line up for lunch, and be able to understand simple WH questions, starting with questions like who, what and where, and followed by more abstract questions such as explaining how and predicting or providing reasons why. Children need to be able to express what they need, what they want, and to share their opinions and contribute verbally in class. And they should be able to speak clearly so that other people can understand them. We are going to go into a little more detail into each area of the language pyramid, starting with attention. Why are attention skills so important? Attention skills develop from an early age, starting in young children with single channel attention, where children can focus on one thing at a time. At this stage, children are easily distracted and need adult support to help them focus their attention. Children's attention does develop and they become better at focusing their attention on one thing at a time. But by the time they start school, they should have what we know as integrated attention, where they can listen to a person talking whilst doing another activity at the same time. We know that visual material is easier for children to attend to, as it is usually more concrete, and language or words are more abstract and fleeting. Be aware of distractions and background noise, as children need to work hard to block these out. It helps if there are times when distractions like the television or the use of tablets are switched off, so that your child can focus their attention and listen to others talking with them. It is important to remember that when your child is engaged with a tablet, a screen, or the television, this type of attention is self-directed. Your child needs to develop joint, shared, and integrated attention in order to help them to be ready for school. We are now going to think about play and why play is so important. Play is important. It is your child's work, but it is also fun and motivating. Play activities that your child enjoys are the best ways for them to learn. Preschool children learn more through play than through structured teaching. They are learning all sorts of things as they play, developing their cognitive skills, for example, learning about shapes and sizes, how things work. They're developing their motor skills, movements, controlling their bodies, social interaction skills, including turn-taking, sharing and role play, and finally language, understanding that words represent an object. Children starting school in September will go into a reception class, and reception continue the same play-based curriculum that your child has been accessing in nursery. Understanding language develops alongside play, as children learn which words go with which object or action as they play. Children learn best when they feel relaxed and happy, and they are then most likely to learn new words and do better talking. As your child plays, they develop symbolic understanding. This is the understanding that toy objects can represent real ones. For example, pretending to give your teddy a cup of tea or a pretend piece of cake. This is important for language development, as words are just symbols representing a concept. Symbolic play helps to develop this understanding. In play, children explore how objects work and how actions can change outcomes, which develops their child's ability to think things through and to problem solve. Play provides a safe space for children to try out ideas that might be frightening or challenging. In role play, such as pretending to be a teacher, or pretending to be in the play kitchen, or in collaborative play, where children are building something together or playing a game with rules, this type of play helps children to work out the relationships between people, how to behave and what to expect in different situations. Play enables children to express their imagination and creativity through music, dancing, making things, painting. It gives the child a sense of self-esteem and pride. In play, everyday situations can be reenacted using toys that different storylines can be applied to and different consequences played through. The stages of social play focus on how play develops with other children. The stages of social play begin with solitary play, where the child plays alone and has little interaction with others. At this stage, children are often absorbed in their own activities. This develops into spectator play, where children become curious and start to watch and observe other children playing, but they're not ready yet to directly interact with others. Parallel play is when children start to play alongside. They may be sharing play equipment and watching other children, but there is still minimal interaction at this stage. Associative play is an extension of this, where children start to play closely together, sharing activities, sharing play resources, and interaction starts to develop as children enjoy playing with the same activities or equipment. But at this stage, they're still not sharing their play ideas. Cooperative or group play is the final stage of social play, and this is where children can play together in a cooperative way. Once in school, your child will be expected to engage in cooperative play with other children in a group. In our language pyramid, play and interaction are linked closely together. Social interaction skills include non-verbal skills. These are important as they help the child to direct and respond to communication in an effective way. Non-verbal communication skills are cues to tell us when we can take a turn, or whether someone is happy to see us, or if we have upset someone and need to adjust our actions accordingly. They include eye contact, the use of gesture, pointing, and facial expression. Being able to share attention with others is important in play and in conversation so that we can play and talk about the same thing. Taking turns and sharing while playing or having a conversation is also important, as this should flow to and fro from one person to another. Getting conversation started by initiating and sustaining the interaction with turn-taking is a way that children can build their social relationships and make friends, and this often occurs during cooperative play when children are enjoying playing a game together. Finally, the purpose of language is important, and some children need a little bit of help developing how to use the language skills they have in order to make requests, share their opinions, and be part of things. The next area on our language pyramid is understanding. Why is understanding important? Understanding is the bridge to talking. Children need to understand what words mean before they can use them effectively. Children often understand more than they're able to say. You will have found this if you have ever tried to learn a foreign language, and you find that you can understand more of that language than you're able to speak. Children start to develop understanding within the context of their daily routines. And then children start to understand the meaning of individual key words. An example of a key word is if you present your child with a selection of 3 or 4 different fruits and you ask them to find one. For example, find the apple. This is an example of your child being able to understand and follow an instruction with one key word, which is apple. The keyword understanding roughly corresponds to the age of your child. So at about a year old, your child will be able to understand language at one key word. At 2 years, they can understand language with 2 to 3 keywords. It is important to think about developing your child's understanding through modelling language and labelling for them, rather than by asking questions to test them. This then provides opportunities for your child to learn and make links between the language they're hearing with what is actually happening. Not all language is easy to understand. Understanding concrete language, such as the names of objects, is easier than understanding abstract concepts, such as size. Words like big and small vary in their meaning depending on what they are being compared with. Many children with good memories learn predictable language by rote, such as counting numbers in a sequence. However, really understanding what those number concepts mean, understanding, for example, that 6 is bigger than 2, is a more abstract concept and harder to understand. Understanding emotional language is also a difficult concept for many children to understand. Being able to link the emotional words for feeling happy, feeling sad, feeling anxious or worried, directly to actually what the child is experiencing when they're feeling those emotions is something we sometimes need to help children to do. Some questions are harder to understand and respond to than others, and answering open questions is much more difficult. Questions like, "What did you do today?" or "What is happening?" is much more difficult for your child to respond to. Try breaking those longer, open-ended questions down into shorter questions that just require a simple answer. Answering why questions are the hardest questions of all. They require the child to provide a reason. Why always is linked with a because, which is the reason. Expressive language is the next area in our language pyramid. What do we mean by expressive language? Expressive language refers to the words and sentences that your child is able to speak when they talk with another person. It is important that people remain the focus of talking and that the language your child is able to use is orientated towards another person. We want to encourage children to be able to use their language in a functional way so that they can share their needs and wants with us, including asking for help. Examples of useful functional language include being able to use social phrases, such as greetings, but also questions in conversation like, "How are you?" "Can I play?" Giving compliments, making comments, asking questions and answering them. We expect children to generate their own spontaneous language, but many children also learn language by copying or imitating phrases, either from adults, or from stories, or from things they've seen and heard on television. Helping your child to use their language in a functional way will support the development of their language and interaction. Having a focus on action words or verbs will also help your child create more novel sentences, as you need these words, these action words, to form a sentence. Action words or verbs are more abstract in nature, and we need to just make sure that children are able to use these to move their language forward. Using people's names will also help the child to keep their language people-focused, and it is certainly useful thinking about when your child starts school that they know the name of their new teachers, so they can start to practice and use these, as well as the names of people within their family and also the friends that they've already made. Modelling grammar is important. Some children who have learned by copying language or imitating language really need support in how to use grammar when they start to create their own sentences. Speech sounds are the final area on our language pyramid. From the referral information provided, no one at this talk should have a child with a difficulty that is primarily affecting their speech sounds or fluency, which we sometimes call stammering. If you are concerned about this area, please discuss when you have your one-to-one consultation with a speech and language therapist. Speech sounds refer to the way a word is pronounced, the intelligibility of that word, and how your child is articulating the speech sounds within words. The speech sound system develops until your child is about 7 years old. Some speech sound errors are typical at certain ages. For example, the word sun is often produced as dun. The word car can be produced as tar. It is important that other skills on the language pyramid, such as attention, interaction, understanding, and expressive language, are developed before this area is focused on. And the idea is that as we work on these areas of speech sounds, the child is able to monitor themselves and be aware of their own speech clarity. Emotional regulation is not directly addressed on the language pyramid, but it is an important factor, as emotional regulation can impact on your child's communication and behaviour, especially at times of change. Emotional regulation is the ability to recognise your emotions and manage how you feel or respond in a variety of different situations. Situations that are new and less predictable, such as starting a new school or leaving a nursery, are likely to challenge your child's ability to regulate their own emotions. You now have the opportunity to return to the language pyramid and think about areas of communication that your child is good at, or where they might need a little more help. This will then be discussed further in your one-to-one consultation with a speech and language therapist. We are now going to look at strategies of what you can do to support your child's communication. What we do know is that parents do not cause their child to have difficulties with learning language or communication, but you really can make a positive difference in helping your child to develop their language and communication skills. To develop your child's attention, visuals really help. Using pictures on a now next board like this helps to keep your child on track with the current activity. By showing them what is now and what is next makes the predicted sequence of events clear and concrete. Some children respond to a countdown strategy that helps to prepare them for a change in what's going to happen next. A countdown strategy is when you give a time limit. You might say to your child, "We've got 1 more minute playing with the bricks, and then we're going to sit down for our snack and have our banana." As the time gets closer to the 1 minute, you then give the countdown. 5, 4, 3, 2, 1. Bricks are finished. Now we can have our snack. In the same way, the use of a timer can also help. Agree with your child how many minutes you're going to set the timer for, and then you can set the timer on your phone, a tablet, or just using the clock. Maybe 2 minutes, maybe 3 minutes, and as soon as the time has clocked down and the alarm goes off, your child knows that's the end of that activity. They're going to move on to the next one. Having predictable routines can also support your child's attention, as they get to learn what is expected as they go through the routine. Having familiar routines really does help their attention, but there might be some aspects within that routine that are not that motivating. Including things like using songs for aspects within a routine that are not that motivating can help your child engage in that routine. For example, using the Tidy Up song. The use of visuals, pictures or objects can also help support attention. If your child has walked away from an activity because they've lost their attention, you can get the picture and show them, just to help them remember what they need to be doing. Remember, we're playing with the bricks for 1 more minute, and then we're going to have our snack. The other way you can use pictures is in a slightly longer sequence. Say, for example, getting dressed or getting ready to go out somewhere, putting things in your bag. Having little pictures for each step of that routine can also help your child to engage and follow one step at a time, with the pictures as a visual cue. Creating opportunities for your child to communicate. If you remember, at the bottom of the language pyramid, we said that children need the opportunity and the motivation in order to communicate. Some children may need clear prompts to help them to use their language to talk to another person. You might want to try offering a choice to your child and then waiting. When you offer a choice, you might want to include the real objects or pictures of the objects, or simply say the words. For example, if you're sitting down for a snack, you might want to say to your child, "We're going to have a snack now. Do you like banana or apple?" And then wait to see which one they select. You might want to interpret your child's behaviour for when you see that they need help. Give them the language that they need so that they can learn from you what they might need to say when they're next in that situation, and then wait to see how they respond. Offering a little bit at a time is a great strategy for encouraging your child to make lots of requests from you during play. This is sometimes called the keeper strategy, where the parent or carer can be the keeper of a favourite activity that your child really loves, that is in sight but out of reach. For example, if your child loves to play with the trains, you could set up the train track and put one train on the track, and then have a big box of trains that are in sight but out of reach of your child. Encourage him or her to ask for another train, and then give them one train at a time to keep them coming back to you to ask for more. The final strategy on here is creative stupidity, and this is where you can make a deliberate mistake. This gives your child the opportunity to just correct you and repeat their request. It can be a real fun and playful strategy that your child will enjoy engaging with. An example of this is your child has asked for another train and you give them a teddy bear. What do? Do they accept it? Do they shake their head? Do they push it away? Do they repeat their request? All of those things, they are using their communication skills to talk to you and tell you you've got it wrong. Children learn language by hearing other people talking with them. When we model language to our children, we are teaching them what to say and how to say it. The strategies that we call the 4 S's help us make our language modelling accessible. The 4 S's stand for go slow, show, say less, and stress. Go slow means putting in pauses so that your child has time to process what they've heard and also has time to plan what they want to say in response. Use things to show your child as well as saying things to your child with gestures, with pictures, by showing them objects within the room. That helps build the links between what is being said and what you're referring to. Say less. Just cut out the unnecessary words so that your message is really clear. Try and use short and clear sentences. And stress the key words so that your child can really make those links between the words that are really important and meaningful and what they're referring to. Being able to start, join in and continue a conversation will help your child to make and maintain interaction and build friendships, especially as they start to meet the new children and the adults working with them at school. Help your child to practice their conversation skills with you at home by following these conversational tips. Use pausing. When you pause in a conversation, that pause or wait is a cue for your child to take their turn. Sometimes this just needs to be quite obvious and clear. With a pause, you can also look expectantly towards your child as though you're expecting them to say something. That gives a clear message that it is your child's turn to come in and join in with the conversation. You might want to encourage them to tell you a little bit more. So you might want to say, tell me one more thing about this. For some children, they have very strong interests and they like to talk about them a lot. And that's fine. But actually, if you want to change the topic of the conversation, that phrase can also be used to help your child understand that the topic is coming to an end and it'll be a new topic. So if your child really loves to talk about trains, you might want to say, tell me one more thing about trains, and then we're going to be talking about something else. You can give your child a choice in conversations. Again, a choice of topic, a choice of comment, a choice of answer, just to help your child keep going with the conversation. If your child has very strong interests and they like to talk about them a lot, I think that's fine, but just have set times when you want to talk about those special interests so that the conversations that you have with your child are more balanced. If your child goes off topic and starts to talk about something else, you can refocus them on what you want them to think about and to hear by clearly introducing the topic. For example, saying something like, I know you really want to talk about trains, but right now I'm asking you what you want to have for your lunch today. You may want to build in opportunities to model the language of useful social phrases for your child. When playing with your child, it is good to model phrases that your child can then use once they're in school, playing and interacting with other children in their class. Phrases like, can I have a turn? Or, can you help me? Do you want to play? Or, can I play? Are all useful phrases, and you can try these out as you're playing together in the home environment. You may also want to model the language your child might need if they want to ask for help or if there's a problem. Just build this in to your daily play at home so that your child can hear the kinds of things that they might want to say if they notice a problem in school or they need to ask for help. We've talked about having conversations and using language in conversation, but also I think it's important to practice things like greeting other people by name and also practice giving compliments and making nice comments about other people and what they're doing. Some children can experience strong emotions, especially when routines change. You can help your child to manage their emotions. The first step to emotional regulation is helping your child to identify and say how they feel. But emotional language and concepts are very abstract, so it will help your child if you can label for them the emotion that your child is experiencing in real time. This will help them learn how to say how they feel. Model talking about your own feelings. It is important for your child to understand that everyone experiences different emotions. It is not possible to be happy all the time. Zones of Regulation is a colour-coded programme that is widely used in school. The aim of this programme is to help children to identify and manage their own emotions, and there will be some more information about this on our website that I'll talk through in the next slide. It is understandable that school transition, going to a new school, will affect your child's ability to regulate their emotions. It may help your child to identify and use activities that help them feel calm. This may include sensory activities, such as listening to music, playing with water, just being in a quiet room, or having a fidget object like a squash ball. There are lots of additional resources on helping children manage their emotions on our website. We have lots of resources specifically targeted for emotional regulation on our website under the heading School-Age Students, but these will be suitable for your child in preparation for school entry. It includes an introduction to Zones of Regulation programme that I mentioned earlier. It is important that you help prepare your child to make the transition into their new school. Lots of children will feel anxious about this, but for children who have language communication difficulties and difficulties regulating their emotion, this will raise a considerable level of anxiety. So here are some things that you can try. Visit the school with your child and take some photographs where this is possible. You may need to ask for permission first. It might be possible that the school can send you some photographs, and there will certainly be photographs on the school website. Ask the school if you can visit on your own with your child. Walk past the building at playtime and when it's quiet. Talk about this with your child. Talk and think about what you can see. Use a visual timetable the week before your child is due to start school. You might want to use a calendar, or you might just want to use pictures. And for some children it helps if they can take in with them a transition object from home to school. Special time is a time that is set aside each day for you and your child to play and talk together. There should be no phones, no tablets, no books, no television, just a quiet space for you to enjoy time together and to give you the opportunity for some one-to-one time with your child. It is important that you try and choose a quiet place without distractions and keep it short. 5 to 10 minutes is enough. It is better to do a short time on a regular basis than a longer time, but less regularly. Sit-down activities are best, but it depends what your child enjoys doing. Once you have established a special time routine, you can then start thinking about some of the strategies that we have discussed earlier. Thinking about playing with your child, modelling language, having conversation with your child, or thinking through and preparing them for their transition into school. If your child is learning English alongside another language that you speak as a family, then remember that being bilingual or multilingual is an advantage. We would advise that you talk to your child in the language that you feel most comfortable or fluent in. It doesn't have to be English. Having a good understanding of the language that you speak within the family will help your child to map on a new language onto that secure language. Please read some of these evidence-based headlines about being bilingual. It's something to be really proud of. Now it's time for you to think about one thing that you want to try and transfer into your home setting now. So think about some of the strategies that we've talked about and think about how you're going to implement this. You might want to set up a special time between you and your child. What we'll do when we have our one-to-one consultation with you is we'll ask you how you're getting on with the strategy that you've been trying at home. So have a think now and have a go. For your information, we have some really active local support groups for families. We have a charity called Skylarks. They are an independent charity based in Twickenham, and they provide activities and therapies, advice and information for children and their families where children have disability or an additional need, and the website address is there for your reference. The other support group we would direct you to is called Kids. It's Richmond and Kingston, Sendias, and they are a free and confidential and impartial service for parents of children with special educational needs. So if you're really concerned about your child starting school and you feel they may need some additional support, they're also a good source of information. Here as well are some useful websites that you might want to look up. We have the Literacy Trust that has advice sheets on many different topics and you can print them out. Hanan, which has lots of information on parent and child interaction. ICANN, which is a national charity, and they have an information forum called Talking Points. Lots of useful tips for parents on there. And then we have a website devoted to children who are growing up within a bilingual family. Thank you very much for listening to the Parent Talk About Talking. This is the end of the talk, but just to leave you with the next steps. So from today, just think about some of the strategies and just start trying them out with your child at home. A speech and language therapist will be in touch with you to discuss your concerns about your individual child and to make a plan moving forward.